Hello guys, so now we shall be discussing another one more important topic in pediatrics, that would be craniosynostosis. Okay, so what is this craniosynostosis? Craniosynostosis. So craniosynostosis is nothing but fusion of the cranial sutures prematurely. Okay, premature fusion of cranial sutures. All of you know we have got all the different types of cranial sutures, right? So in this picture which you can see, all these lines here, whatever you see, these are the sutures, cranial sutures. Now, why do we need cranial sutures? Why do we need cranial sutures is that, for example, after a few months after the birth, let us say these cranial sutures are fused. Okay, let us say that hypothetically speaking, these cranial sutures after a few months so as you can see, all these are the cranial sutures, right? Let us say that immediately after the birth, let us say few months after the birth, these cranial sutures are fused. Now when the cranial sutures are fused, the brain which is inside, right, don't you think as the age increases the brain size also increases? Now as the brain size is increasing, on the top the cranial sutures are closed, right, and down here the brain size is increasing. Now do you think the brain, can it fully stretch, can it increase? No, because the sutures are completely closed. So when sutures are completely closed, the brain development will not happen, the brain will not increase in size, the brain will shrink in size, or the brain will remain in the same size, right? So why do we need sutures is that these sutures, they allow the growth of the brain along with the growth of the bone also, the skull bone also. Okay, so if there is a suture like this, right, so you see a gap between, this is a suture. If there is a suture like this, my thumb is representing the brain here, right? So as the brain is developing, what will happen, this brain will push the cranial, this brain will push the cranial bones. So cranial bones are not yet attached here, so what will happen is that there is flexible stretching of the brain along with the cranial bones in this way. Slowly in this way, the circumference of the skull, the circumference of the head, or the brain development, whatever it is, everything will happen in a proper way. Okay, so this is what you need to know here. So it happens in a proper way. So for that reason we need sutures, right? So next important thing is that, let us first of all, before discussing what is craniosynostosis, first of all, before discussing what is craniosynostosis, first of all we shall discuss what is the normal anatomy of the skull, what are the sutures that are located here, right? Now after this we shall enter into the topic and discuss that in very much detail, okay, about each and every pathology. And after discussing all the pathologies, I mean all the types of craniosynostosis, at the end I will discuss the pathophysiology of why this is all happening. Okay, if I discuss pathophysiology now, you won't understand it, so the best way to teach is at the end now. Okay, fine, right? So here if you see here, now few important things you need to understand here. What are the few important things are, see this bone which you can see is the frontal bone. Okay, so how many frontal bones we have got? We have got two frontal bones. Okay, next, how many parietal bones we have got? We have got two parietal bones. How many occipital bones we have got? We have got one occipital bone on the back. Okay, so two frontal, two parietal and one occipital are joining together to make a couple of sutures. What are these sutures? We shall see. Okay, so between the frontal bones, this suture which you can appreciate over here, this suture is called as mectopic suture. What is this suture called? Mectopic suture. Okay, next, between the frontal bone and the parietal bone, this kind of suture, whatever you can see, this is called as coronal suture. This is your coronal suture. Okay, next important thing is that between the two parietal bones, this suture which is straight like this, right, exactly here straight, this is called as sagittal suture. This is called as sagittal suture. Okay, and next you see another suture here, right? So the shape of the suture is lambdoid shape, right? So this suture over here is called as lambdoid suture. Lambdoid suture. So very important thing you need to understand here is that how many sutures we have got? Four sutures. So one is called as your mectopic suture, coronal suture, right, sagittal suture, as well as lambdoid suture. Okay, now before I go into further details, first of all, let us write down what are the things we have just spoken here. Okay, so your cranial bones, which are also called as neurocranium or cranial bones. Neurocranium or cranial bones, right? They are comprising of how many frontal bones, guys? They are comprising of two frontal bones. How many parietal bones? Two parietal bones, two parietals, and how many occipital bone? One occipital bone. Okay, now we discussed that two frontals, they join together to form a suture, and that suture you call it as mectopic suture. Two parietal bones join together to form a suture, that is called as sagittal suture. Okay, in the same way, these two parietal bones and one occipital bone together, you see at the picture, look at the picture here, the two parietal bones, right? You can very clearly see that this is a parietal. The two parietal bones and one occipital bone together like this, they formed a suture here. This suture is called as lambdoid suture. So two parietal and one occipital together formed lambdoid suture, right? Now, after the sutures are discussed, next important thing is that, can you see some gaps where the sutures are meeting, right? So you can see this junction, right? You can exactly see this junction where all the sutures are meeting here, right? So these junctions are called as fontanelle, right? So there are two fontanelles, one on the front and one on the back, right? Actually there are two more fontanelles also, I'll show it to you, but here there are two fontanelles, one is on the front, one is on the back. So this fontanelle which is on the front, this is called as anterior fontanelle. Okay, and which is on the back over here, this is called as posterior fontanelle or occipital fontanelle. Okay, posterior fontanelle. Okay, now just look at anterior fontanelle and see how many bones are taking place here to form this anterior fontanelle. Anterior fontanelle is formed by two frontal bones and two parietal bones. Is occipital bone taking part in the formation of anterior fontanelle? No. Okay, in the same way, if you look at the posterior fontanelle is formed by two parietal bones and one occipital bone. So let us write that down. So what I was just telling you is that anterior fontanelle, right? So anterior fontanelle is formed by two bones. What are those two bones? We have got two frontal bones, and we have got two parietal bones. Two frontal and two parietal form the anterior fontanelle. Next we have got the posterior fontanelle. Right, so posterior fontanelle is formed by again two bones. What are those two bones, guys? We have got two parietal bones and one occipital bone. Two parietal as well as one occipital bone. Okay, right. Now apart from this, nowadays they are going to ask you the question that what sutures are helping in the formation of anterior fontanelle. So just look at the picture here. Anterior fontanelle is formed by mectopic suture, it is also formed by coronal suture, and it is also formed by sagittal suture. So which suture is not taking part in the formation of anterior fontanelle? That is your lambdoid suture. Okay, now in the same way, posterior fontanelle is formed by two sutures. One is called sagittal suture, one is called lambdoid suture. And which suture is not taking a part? Mectopic suture is not taking a part. Not only mectopic, coronal suture is also not taking a part. Okay, so let us see. Let us write these things also down. So here anterior fontanelle is formed by three important sutures. Okay, three important sutures. What are those three important sutures? One is called as mectopic suture. One is called as mectopic suture. Another one is called as coronal suture. Mectopic suture, coronal suture, and the next one is called as sagittal suture. Sagittal suture. Okay. In the same way, posterior fontanelle is formed by two sutures. So what are those two sutures, guys? One is called as sagittal suture. Okay, and the next one is called as your lambdoid suture. Lambdoid suture, right? So these are some of the important things that one definitely has to know. Okay, these are some of the very important things you have to know, right? Now, next important thing is that I already told you along with two fontanelles, right? So we have got this anterior fontanelle over here, we have got this posterior fontanelle over here. Along with that, we have got two more fontanelles that you can see on the lateral view. Okay, so in this weave, you can see one fontanelle here. All of you look here now. See, this is your parietal bone, this is your frontal bone, this is your temporal bone, and this is your sphenoid bone. Okay, so exactly here you see a fontanelle. Actually, these sutures are fused here, but look at this picture over here. In this picture, you can very clearly appreciate this is your frontal bone, parietal bone, this is temporal, and this is sphenoid bone, right? So at the junction of all these bones, you see a suture here, you see a fontanelle here. This fontanelle is called as sphenoid fontanelle. Okay, so if I write down like this, sphenoid fontanelle, right? So when is by which bones this sphenoid fontanelle is formed, guys? Sphenoid fontanelle is formed with the help of frontal bone, right? With the help of parietal bones, and don't confuse, most of you put it as not temporal bone, it is sphenoid bone. Okay, it is sphenoid bone. Now after this suture, if you exactly look, guys, on the back side, on the back here, see, here also you can see the three sutures joining together to form a fontanelle. Again, this is a picture, or this is a fused picture, right? You cannot appreciate it, but look at this picture here. So here very clearly you can see that there is a space, right? And there are three bones. What are those three bones? Parietal bone, temporal bone, and back kya hai? Occipital bone. So these three bones together, they join and form, you see, these three bones together, they join and form mastoid fontanelle. Okay, so next fontanelle is mastoid fontanelle. So mastoid fontanelle is formed by what all bones? You have got your parietal bones. Okay, and after parietal bones you have got your occipital bone. Okay, and after that you have got your temporal bone. So these bones together, they form your mastoid fontanelle. So overall, how many fontanelles we have? We have got 4 fontanelles. So what are those fontanelles? And we shall also see that each fontanelle closes at a specific age group. Okay, so we shall see what are these fontanelles. The first fontanelle here I will be writing is the posterior fontanelle. Okay, then I'll write the sphenoid fontanelle. I even want you to remember the same way as I'm writing here. Okay, sphenoid fontanelle. And next we have got the mastoid fontanelle. And down the ventral side it is the anterior fontanelle, and the posterior is on the top. Okay, so posterior fontanelle. Posterior fontanelle, ventral side in the sense, not in the real picture, guys. While I'm writing here, the down one is anterior, upper one is posterior, I'm telling. Okay, so let us see these fontanelles, when do they close, right? So immediately after the baby's birth, guys, when you press the region here, it will be soft. Why? Because the sutures are not yet closed, there are fontanelles. So these fontanelles close at a specific time period. So at what time period will they close? We will see. First, posterior fontanelle closes at 2 to 3 months of age. After the birth, at 2 to 3 months of age, it will close. Now, what is a multiply 3 with 2? 3 twos are 6, right? So, sphenoid fontanelle closes at 6 months of age. Okay, so it closes with 6 months of age. Next important thing is 6 to 18. The next one is 6 to 18 months. Okay, so 6 into 2 how much? 12. So 12 to 18 months. Okay, so these are the closures of fontanelles, and these are the standard values which I have taken from the research papers. Okay, so 2 to 3 months, 6 months, 6 to 18 months, and 12 to 18 months. So these are the times where these fontanelles close. For example, if posterior fontanelle closes before 2 months, if sphenoid fontanelle closes before 6 months, if the remaining also close before 6 and 12 months, then what you call it as, this is called as premature fusion, premature closure of fontanelles. You call it as premature closure of fontanelles. Okay, so how does a premature closure of fontanelle look? Okay, so we shall discuss one by one now. So first important, all these are types of Craniosynostosis. So the first important type we shall be discussing is called as Scaphocephaly. Scaphocephaly. So the other name for Scaphocephaly is Dolichocephaly. The other name for Scaphocephaly is Dolichocephaly. Now what will happen here is that all of you know that where is the sagittal suture, guys? See, this middle one is your sagittal suture, right? Now this sagittal suture, actually it has to close at a certain time. Now this sagittal suture closes prematurely. Okay, so when the sagittal suture will close prematurely, what will happen? Just look at the picture now. Okay, you see this is a normal, this is normal, where you have sagittal suture, and here there is no sagittal suture. Sagittal suture is closed. Now when sagittal suture is closed, now look at the concept here. Sagittal suture is closed. When the sagittal suture is closed, if the brain wants to grow, right? If the brain wants to grow, can it go laterally? No, laterally you have parietal bone. This side also you have got parietal bone. Okay, so previously the suture was like this. So suture was like this, and these two bones are parietal bones, and this suture in between the parietal bones is sagittal suture, right? So when the brain was growing, what was happening? The parietal bones were moving aside like this, right? So it means the parietal bones are moving slowly laterally like this. But now as both of them are closed, can the parietal bones move laterally? It cannot move because they are closed at this point. So the only way how the brain can develop right now is that the brain will see wherever there is space, it will try to grow in that way. So which sutures are not closed here? Occipital, I mean in this picture you cannot find out occipital suture, but here occipital suture is not closed, and in the front coronal suture is not closed, and in the starting in the anterior side there mectopic suture is also not closed. So brain is finding a space to grow there. So what will happen? Brain starts growing anteriorly like this, brain starts growing backward like this. Side to side brain will not go because these bones are closed. Okay, the bones are closed. So there is no side to side growth, there is no lateral to lateral growth, there is only anterior to posterior growth. Okay, so when you look at the real child, this is how it looks. You see, laterally there is no growth. Okay, you can see here very clearly that laterally there is no growth. There is no growth laterally, but antero-posteriorly there is a growth. Okay, so can I tell this kind of skull is also called as a boat shaped skull, right? It is also called as a boat shaped skull. So I hope you understood whatever I've taught you. Hai. So what will happen here? This kind of skull is called as Scaphocephaly or Dolichocephaly, where the sagittal suture will fuse. Fusion of a suture is called as synostosis. So I have to call it as Sagittal Synostosis. Sagittal Synostosis. Now this Sagittal Synostosis is the most common type. Okay, it is the most common type of Craniosynostosis. We are discussing right now Craniosynostosis only. All these are the types, right? So far we discussed first type. So this is the Synostosis. So this is the common type, most common type. Okay, right. In this sagittal suture is fused. Now what will happen is that there is a restricted growth. Which growth? Lateral or anteroposterior? Lateral growth is restricted. There is a restricted lateral growth. So when there is a restricted lateral growth, the skull grows anteroposteriorly. Anterior posterior growth is maintained. So there is a restricted lateral growth, hence anterior posterior growth is maintained. And such type of skull, you call it as a boat shaped skull. Okay, you call it as a boat shaped skull. So such type of skull, you call it as a boat shaped skull. So first pathology we discussed was Scaphocephaly or dolichocephaly. The second one we shall be discussing right now, right? This is called as Plagiocephaly. The second one we shall be discussing right now is the Plagiocephaly. Okay. Now Plagiocephaly is of two types. What are these two types of Plagiocephaly? Anterior and posterior. Okay. Anterior and posterior. So there are two types of Plagiocephaly, anterior as well as posterior Plagiocephaly. Now what is this anterior and posterior Plagiocephaly is that, see, anteriorly what suture we have got? Coronal suture. Posteriorly what suture we have got? Lambdoid suture. So what will happen here is that, just look at this picture only. Anteriorly there is coronal suture which is transverse. Posteriorly there is lambdoid suture, right? Now out of two coronal sutures on the right and the left, one coronal suture is absent. मतलब फ्यूज हो गया. Okay, one coronal suture will be fused. So can I tell it as unilateral fusion of coronal suture? In the same way, this is also called as anterior plagiocephaly. If I tell posterior plagiocephaly, posteriorly what suture I have got? Lambdoid suture. So posteriorly lambdoid suture there is on the right, a suture on the left. So ठीक है, इन दोनों में एक, out of these two one will be fused. So unilateral what suture? Unilateral lambdoid suture fusion. Okay, unilateral fusion of lambdoid suture. So unilateral fusion of coronal suture is anterior plagiocephaly, unilateral fusion of lambdoid suture is posterior plagiocephaly. Okay, so here let me put up this thing. Yeah, I'll show you the picture always, don't worry about that. So here there is unilateral coronal suture fusion. Okay, unilateral coronal suture fusion, and here there is unilateral lambdoid suture fusion, unilateral coronal suture fusion and unilateral lambdoid suture fusion, right? Now what is the most common one? We already discussed dolichocephaly, right? Now which is the second most common? Is this anterior plagiocephaly is the second most common type of coronal suture. Second most common type of craniosynostosis. I'm sorry, second most common type of CS. CS matlab craniosynostosis, right? Don't confuse it as cranial suture. Let me write it down. Craniosynostosis. This is the second most common type of craniosynostosis. And if I ask what is the rarest type of craniosynostosis, that is a posterior. So this is the rare type. Okay, so this would be the rare type. Now just look at the pictures, guys. In the first picture, these are the real images. Now in the first image you can see here, see this suture which you can see in the center here, I'm rubbing it again, look at the picture here, you see this suture which you can see in the center, this suture is your mectopic suture. And you see this suture here, this is your coronal suture. We have coronal suture on the right side, but there is no coronal suture on the left side. Why? Because it is fused. If you are looking the same image from the top also you see this is mectopic suture, this is a sagittal suture, and this is a coronal suture on one side. You see another, you see a ridge here. What is this ridge actually? This shows fusion. Coronal suture on the left side is fused. Okay, now what will happen? Now what will happen if the coronal suture is fused? So if coronal suture is fused here, guys, what will happen is that I'm rubbing these lines. The brain tissue, do you think can it develop in this direction? Yeah. Now, can this brain tissue develop in this direction here? No. But on the opposite side, there is coronal suture, right? Opposite side, there is a coronal suture. There is a chance of expansion. So what will happen is that the brain tissue starts developing in this direction like this. So wherever the fusion is there, on the contralateral side, there will be growth. Okay. So just look at the picture right now. Right. So this is how it is taking place. Now look at the skull. You see? So now when you look at the skull, where is the development taking place? You see the development is going in this way. If I am drawing a line like this, you see here there is a bend like this, right? Why? Because the development is taking in this direction. And why? Because the suture is closed here. Clear? So you can very clearly appreciate the skull here. So isn't it looking like an oblique skull? Yes or no? It is looking like an oblique skull. Right. So another important image here. So in this image also you see the coronal suture here is completely fused. Because of this fusion, what is happening? The development is happening on to the opposite side like this. Okay. So this kind of skull is the growth happening onto the opposite side. Exactly speaking, contralateral side would be nice. Okay. Opposite side. Clear? So this is called as plagiocephaly. And what plagiocephaly is this? Anterior plagiocephaly. Okay. So this skull is laterally, second point is laterally twisted or oblique skull. Laterally twisted or oblique skull. So this skull is laterally twisted or it is oblique. Okay. Right. Now next important image is that you see the posterior plagocephaly. What is posterior plagocephaly? Unilateral lamboid suture fusion. So where is lamboid suture? On the back. See, on the back you can see the fusion here, right? So there is unilateral. So where will be the development taking place? On the opposite side. It means the development will take place in this side like this. Okay. So I hope you understood this picture. Okay. So this is one more image here. Okay, you look at the skull is laterally twisted or oblique skull, right? Now after this, the next important after plagocephaly and dolichocephaly, the next important would be this. Now what is this condition called? This is called as trigonocephaly. Now with the concepts which you had, guys, just tell me which suture might have been fused. Very good, that is your mectopic suture. Mectopic suture is fused. Which suture is fused? Mectopic suture. So as you can see, this is your mectopic suture in the center and this is fused. Now when the mectopic suture, see, this is the mectopic suture, when it is fused, you see a triangle shape here, right? That is why it is called as trigonocephaly. Now when you look at the baby also, you will feel that triangle shape on the face. You see here, you see this triangle here. So from the side also, from the anterior view, you can appreciate well that there is some feel of a triangle over here, right? So that is why this is also called as triangular shaped head or trigonocephaly. Okay. So here what suture is fused? Mectopic suture, and that would lead to what? Triangular shaped head. Triangular shaped head. Okay, so this is a triangular shaped head which you can see. Now after this is the next picture here. This next picture is the picture of brachycephaly. What is brachycephaly is the sense. See, here we have got a coronal suture like this. Here we have got a coronal suture, right? So both the coronal sutures fuse. So I can write it as bilateral fusion of coronal suture. So when there is a bilateral fusion of coronal suture, this is how it looks. Okay, bilateral fusion of coronal suture, this is how it looks. The next one is clover leaf skull. Clover leaf skull. Now in this clover leaf skull, you know what has happened? What has happened is that, you know, we have got mectopic suture, right? Mectopic suture, right? The suture which is located here, mectopic suture. Next we have got coronal suture, right? Coronal suture, the suture which is located here, coronal suture. And next on the back we have got lambdoid suture. Lambdoid suture. So all these sutures, they fuse. So because of the fusion of all these sutures, this is how the skull looks, right? Now if you look at the real image, this is how the real image looks. This is how the real image looks. Now in the real image also, can you see that the skull is divided into 3 lobes? See, this is lobe number 1, lobe number 2 and lobe number 3, right? So can I call this as a trilobar skull, right? So this kind of skull is called as a trilobar skull. Now what is happening in this condition is that, guys, when all the sutures, almost all the sutures are fused, right? There is only one suture which is not fused here, that is sagittal suture. So here this sagittal suture has got a gap. The sagittal suture is not fused. When the sagittal suture is not fused, what is happening? See here. For example, this is the cranial cavity, right? Cranial cavity. Now in this cranial cavity here, like this, in this cranial cavity here, this suture which you have in the anterior is mectopic. Okay, this suture which you have on the sides is coronal, and this suture which you are having towards my direction, this is called as what? This is called as your sagittal suture. So sagittal suture is not fused. All the sutures are fused. So what will happen? The brain starts growing towards the sagittal side. That is why you see a bump here on the top. Yes or no? And second important thing is that I told you here and here we have got sphenoid and mastoid sutures. They are also not fused. So brain even starts growing in this way also. That is why you can see 2 lobes on either side. So that is why it is called as a trilobar skull. So what will happen in this is that as the brain is developing, brain cannot develop completely, right? Why brain cannot develop? All the sutures are closed. There is a complete skull bone now, skull vault here. So there is no way to escape. There is no way to spread out. So in such cases, what will happen is that the brain will undergo compression, right? So brain will starts to grow. The more it grows inside, the more it compresses. And not only that thing, that within your brain you have got ventricles, right? For example, if there is excess amount of fluid within the ventricles, you call it as hydrocephalus. And the normal amount of fluid only, if you are not allowing it to pass, it means I'm telling there is some obstruction within the ventricles, that is also called hydrocephalus. So hydrocephalus is 2 things. Either there is increase in level of CSF in the ventricles, or there is obstruction for the outlet of CSF. So here when the skull cap is compressing the brain in all the directions, there will be obstruction. When there is obstruction, do you think the CSF can flow? CSF cannot flow. So that would lead to hydrocephalus. That would lead to hydrocephalus. Not only hydrocephalus, because of this what will happen? The intracranial pressure will increase or decrease? Increase. So there will be raised intracranial pressure, raised ICP. So these are the skulls which you have to know. Okay, so what are the skulls we just discussed, guys? We discussed that we have got what? We have got one is called as Scaphocephaly or dolichocephaly, which is the most common type, right? Remember this, most common type. Second most common type is anterior or posterior, it is Anterior Plagiocephaly. Okay, so this is the second most common type. Rare type is the posterior one, right? And after that we have got Trigonocephaly. Okay, and then we come across brachycephaly and finally cloverleaf. What is this? Cloverleaf skull. Okay, now let me tell you one very important thing. Why these sutures are fusing prematurely? What is the concept behind that? What is the concept behind that is that, for example, let us say, see, this is a skull bone. This is one skull bone. Okay, let us say this is another skull bone over here. This is another skull bone. Okay, now beneath the skull bones, you know that here you have got what? Beneath the skull bones over here, you know, you have got your brain. So this is your brain like this. Okay, and you also know that the outermost covering is the dura mater. So this blue color thing which I am drawing is the dura. This is the dura mater. Now in between this is one bone, this is a second bone. In between both the bones, in between both the bones, you have got some kind of tissue here, and this is nothing but called as mesenchyme. Okay, so this tissue that is located in between two bones, right, two skull bones and dura mater. Okay, and by the way, this is dura mater. Now listen carefully, this is dura mater. So between two skull bones and dura mater, this is called as your mesenchyme. Mesenchyme. What is mesenchyme consisting of? Mesenchyme is consisting of some cells called as mesenchymal cells. Let me draw three mesenchymal cells over here. So these cells are called as mesenchymal cells. Mesenchymal cells. Okay. Now, what will generally happen? How the suture is fused? How is this process taking place? How is this process taking place? Is that normally what will happen is that this dura mater starts releasing some growth factors. For example, it releases a growth factor called as fibroblast growth factor. Okay, so this dura mater over here, it releases a growth factor called as fibroblast growth factor. Now, these mesenchymal cells are already having some receptors. These receptors are called as fibroblast growth factor receptors. Okay, so what this fibroblast growth factor will do? It will go and attach to this fibroblast growth factor receptors. The moment it will attach, mesenchymal cells, they get activated. Now this is one kind of signaling the dura mater is giving to mesenchyme. Yes or no? Dura mater ek signal there hai na to the mesenchyme. Now mesenchymal cells are activated. Now when mesenchymal cells are activated, they proliferate, they divide. Right, I cannot show you that. Okay, let me show the division also. You see, the mesenchymal cells started to divide, and what these mesenchymal cells will do is that they will transform into, or they will proliferate into osteoblast cells. Okay, so these mesenchymal cells, they will proliferate into osteoblast cells. Osteoblast cells. Now you tell me, once osteoblast cells are activated, what will happen? There will be formation of a bone tissue. Yes or no? So it means in between the skull, the bone tissue is formed, which actually means there is fusion of a suture. Okay, this is how the sutures fuse normally in you and me. Right? Now, what happens? Why there is premature fusion of sutures is that what will happen is that the genes that are encoding for fibroblast growth factor, for example, let us say there is a chromosome over here. Okay, this chromosome is having some set of genes. Now if I'm activating these genes, what will happen is that these genes start releasing fibroblast growth factor, right? So if instead of activation, if there is a mutation of this gene, what will happen is that either there can be excess amount of fibroblast growth factor released, or there can be absolutely no fibroblast growth factor released, right? So there can be hyperactivation, there can be hypoactivation. So let us say because of this mutation, there is excess amount of fibroblast growth factor that is released. Okay, and let us also tell there is another gene here. When you are activating this gene is encoding for fibroblast growth factor receptor. Okay, so now what will happen if there is a mutation here? ये देखो यहाँ पे भी mutation है. If there is a mutation, the receptor is overactivated. Yes or no? The receptor is overactivated. Now you tell me what will happen. When there is excess amount of fibroblast growth factor, this excess amount of fibroblast growth factor will act on the many number of fibroblast growth factor receptors, right? So as they are keeping on acting, they are keeping on stimulating this fibroblast growth factor receptors again and again and again. What will happen? There is massive proliferation of mesenchymal cells into what? Into osteoblast cells. So I hope you are understanding whatever I am teaching, right? So once excess amount of osteoblast cells are formed, what will happen? Now the urgency is increased to close the suture. So very fastly what will happen? These osteoblast cells, they form the bone and start closing the suture. So this is how the mechanism is taking place. If you want to remember, remember it. If you don't want to remember also, nothing is going to happen. But for MBBS students, for you, you have to remember it. For exam going batches, just remember that there is a mutation in the genes encoding for fibroblast growth factor and fibroblast growth factor receptors. Okay, so this is all the important things you need to know. Next important thing is that how do we diagnose this case? What is the diagnosis? So very simple guys, you already know by now the answers. What is the diagnosis? By looking at the skull itself you can diagnose, right? That is called as clinical diagnosis. Clinical diagnosis, right? And second important thing is that you order an x-ray, skull x-ray. You order a skull x-ray. Apart from skull x-ray, the best one would be cranial CT. And what cranial CT? So cranial CT with 3D reconstruction. 3D reconstruction. Now why do we use this? Why do we use this is that, so with the help of this we can find out whether there is hydrocephalus or not, and second important thing is that you can even plan for the surgery. Okay, you can plan for the surgery or surgical recorrection. So to identify hydrocephalus, and you can plan accordingly for surgical reconstruction. Surgical reconstruction, right? So this is all the important things which you need to know regarding craniosynostosis. Thank you so much for watching my video and goodbye.